Dan and Jan, thank you so much for this award. This means a lot to us. And the work of ARCHway and the SLU Department of Family and Community Medicine are complementary in so many ways. Our department mission is to provide excellence in primary care, education, research, and community service. And care of families who've been touched by addiction is a thread that's woven into both of our organizations very tightly. We're educating medical students, future family physicians, medical family therapists, and future addiction specialists, even as we treat patients who have addictions in our clinics and our offices. At SLU School of Medicine, all medical students are introduced to social determinants of health, addictions, and interprofessional practice early in their clinical training. And when we realized that some medical students want a higher level of training in addressing these social determinants of health, in 2018 we started an urban community health track, which immerses students in our underserved community right from the beginning of their time in medical school. Since 2011, the SLU Family Medicine Residency has been training family physicians in a community health center with an emphasis on integrated behavioral health and with universal training for our residents and experience in medications for addiction treatment. The emphasis on behavioral health, substance use disorder, and including the use of peer specialists has included a strong partnership with our family medical therapy colleagues. And our physicians and MFT trainees complete our program, ready to work as an integrated team, caring for patients with behavioral and substance use disorders. We're especially excited about our new addiction fellowship led by Fred Rotnick, which is a partnership between family medicine, psychiatry, and obstetrics to provide physicians with advanced training in addiction medicine. The SLU Department of Family and Community Medicine is also committed to understanding the connections between physical health, mental health, behavioral health, and addiction. Our research division is in the top 20 in the nation for family medicine, distinguished by its scholarship in substance use disorders and co-occurring mental illness. We're combining many of these resources now into our Center for Substance Use Disorder and Pain Management. Through all of this, our medical family therapy program is a bright star. Medical family therapy faculty and graduate students are providing support and counseling to patients with behavioral health concerns and addictions. At our community health center, our SLU care practices, at Casa de Salud, community sites, and our SLU Center for Counseling and Family Therapy. All these activities are so consistent with ARCHway's work to care for our people and our caregivers and families affected by substance use and mental illness. Our medical family therapists have taken this care to the next level, working with our peer support staff. To tell you more about our most recent collaboration with peers, I'm happy to introduce you to Dr. Katie Heiden-Roots, Assistant Professor and Director of Clinical Services in our Medical Family Therapy Program.
I want to say first thank you for inviting me to be part of tonight. This is a really special event and organization, and I'm just honored to be here. I promise to try and stay on script, although I can make no promises. For the peer specialists who had to deal with me during classes, they know how this goes. So, you all invited me. So I have had the distinct pleasure to get to spend time with some of ARCHway's peer specialists over the past few months. This was made possible by a recent federal grant our department received for addressing opioid crisis from an educational perspective. Our fearless leader for the grant, of course, is Dr. Fred Rotnick. No surprises, right? We call it the COPE grant at SLU. It stands for Create Opioid Preparedness Education. Sorry about that. This grant allows increased partnering with ARCHway as a way of expanding the training of family therapy graduate students in the area of substance use disorders. It also integrated the peer specialists into our family therapy graduate courses as fellow students. I didn't know what to expect, to be completely honest with you. When the peer specialists, Emily Young, Colton Baker, and Jordan Hampton showed up in my classroom. I honestly had a lot of doubts about my own skill as a teacher. I thought I'd have to bring together these two seemingly very different groups of people. But it turns out we're all more alike than different. The class was Introduction to Family Therapy, which is one of our foundation classes, and we teach our students how to connect with clients right away, how to deal with building relationships, and how to help people find motivation to change. I think the addiction folks know better than anyone else that motivating people for change is no small task. So several times in class, I would find myself saying something about either building relationships or how to work with what is classically called the resistant client or patient. And I would look out of the corner of my eye and I would see peer specialists reacting. I would see either head nods, and it felt like, oh, maybe we're talking about a lot of the same things or seeing a lot of the same patients. Sometimes I couldn't tell if I was scaring them or if something I was saying was resonating with them. I have a habit of saying things quite directly. Luckily, they offered me many reassuring comments, which I was very thankful for, and readily applied what we were talking about to their own work. And they offered stories to my students about what it was like to be a peer specialist, which was incredibly valuable to my students as well. So the similarities between our worlds began to evaporate, and the experience was incredibly significant to my students and myself. The whole thing led me back to an old question, a question that's been plaguing family therapy and psychology. To my psychologist folks in the back there, you've heard this question before, and it goes something like this. Is who delivers the intervention more important than the intervention itself? That question has been posed because the research keeps finding over and over and over again that the actual model or type of intervention doesn't really matter. It doesn't vary by if I talk to you about your feelings, if I talk to you about your behavior, or if you decide to analyze your thoughts or childhood or how you felt about your mother. None of that actually really matters. Instead, it varies by how good a particular therapist is with a particular patient. That's what matters. Now, I hope that doesn't scare you all away from going to therapy. Just find somebody you like, frankly. It's about fit. Now, that helps me as an educator because now I'm just really focused on developing good humans who want to sit with other humans who are struggling, right? It gets kind of simple. But when the peer specialist came to my classroom, I had to change my answer to that question. It turns out who delivers therapy doesn't have to be a therapist. Right? I don't know why that's shocking. It was to me, but now it's not. So it's not about it being a particular therapist, it's about it being a particular person. I can't imagine a more effective intervention when you're struggling with addiction than to be met with a walking, talking face of hope. And that's what the peer specialists were. And that's how I came to sort of understand their work. Expertise for them is in that lived experience. And I think if we can empower and support them, we have a chance when it comes to addressing addiction. In many ways, I think additional credentials and higher education, and I'm an educator, so this is going to really sound terrible, but I actually think it separates us from real-world experiences. I think I felt very separated from the addiction crisis that's been going on in this country. It was made plain the ways that I had separated myself from the epidemic, personally, seeing it as a news story, and not really considering my place or my role or my responsibility in being part of the solution. So the peer specialists were an intervention in my classroom and for me. And they're changing our program and our department as a result, and I'm so thankful for Emily and Colton and Jordan, and for their willingness to come into my classroom and put up with me. And I said this to Fred a while ago, but I said to him, I said, I'm all in. Whatever's next with the peer specialist, sign me up. I'll be there. We'll have a blast. And I really think it's the answer to what's next.